We've been here 28 years now. We know the customer, we know their families, we know their parents. We've taken care of everybody. And now kids that I saw as babies are now in college or graduating college, and it's just like, oh my gosh, it doesn't seem possible. I feel like we've grown up with our community.
When the state did close down, my wife, Terry, packed a bag for me, and I was at the store by 4 a.m., I believe, because we didn't know what it was going to mean for healthcare and our patients. So we basically filled every prescription possible for a month out, called all of our patients, called our delivery drivers, got everything delivered out. So by 6 o'clock, everybody pretty much had a month's supply of medication to make sure they had what they needed. We knew our patients were going to be fearful, and we wanted to know that they could trust that we were going to be, going through the process together.
I was making sure that we had everything we needed for our customers to keep our store going. I was constantly looking and making sure we had all our medications we needed. I was always looking for supplies that we needed. I would come in here and I'd work at night when everybody wasn't here, so I'd make sure we were in shifts so we were still all separated and we kept our distances. And I had to make sure that both of us could, were healthy, so that if one of us did get sick, the other one was still here to pick up the difference. We had to make sure that one of us was always going to keep the store going.
We didn't close our doors. We didn't miss a beat. We were vigilant. Jump forward to when the vaccines did come our way. Berks County was left behind, and we were a little disappointed in that. And Jeff Boyd got me in contact with Commissioner Leinbach, and I said, well, we need to develop a plan for our community. And I said, on a Sunday afternoon, I bet you we could do about 3,500. And he wanted to know how. What you don't know is our ties to the community, and what we can do here in Boyertown. We developed a plan where we can unite the churches together, create a network of volunteers. So Commissioner Leinbach asked me to forward that to him, and he had a meeting with Governor Wolf. That next day we were at Frederick Living giving vaccinations to their community, and I opened up my laptop and I saw that we were given our first 1,000 doses of vaccine, which was pretty amazing. The next week we got 2,000 doses, and then from the week after that we got 3,500 weekly. I mean, we were able to create a sound working system of vaccinating large numbers of people in a safe, efficient way. We were able to do it, and it was joyful. You have to remember, at that time we weren't able to even go into hospitals to see our loved ones. People on hospice, people dying alone. It wasn't meant to be. I mean, my wife saw a lot of tears and a lot of joy, and a lot of relief that people were going to be reconnected with their families. It really was a great sense of camaraderie and community. It was a pretty amazing feeling.
Here, we're healthcare professionals first, and we are here together to make sure that our communities are healthy and stay safe, and we just want to make sure that everybody knows that we care.
It is an exciting time in 2022 for the Tri-County Area Chamber of Commerce. We are getting ready to celebrate our 95th anniversary, and I am so happy to have all of you here for one of our major events in 2022. So we have started in-person events again. So we are happy to have had the Pottstown Progress Luncheon in February and have you here for the Boyertown Area Progress Dinner, which is always a fantastic opportunity for this community. Over the last year, we did some virtual opportunities. In addition to that, We took our Chamber Chat podcast live on Facebook, a great opportunity for our members. And we've also been able to just expand member benefits, really inform the Chamber membership on how to use them. And we look forward to growth in 2022 with more to come. We want to make sure that all of the Chamber members get the best value out of their investment.
As a church, we are imperfect people trying to do our very best to know God, grow together, and also how we can make a difference beyond our church. And this facility right here does that. And so back in 2018, we wanted to expand because we were running out of room. When we went down the list, just going down, this became available. In more space, designated space for the youth, community-centered events. We were blessed by this space. We were going to do open houses, and then of course, the COVID hit, and it put a halt into everything. Now that we were more from on our heels, like we're like stuck, feeling that stuck mode, and I was like, okay, let's start rolling. The connection that we're able to, that this facility can provide between the church as well as our community, it actually covers one of the three visions we had for this building, which was to provide community-centered events. We've had car shows, or we've had Tyler's Ride, we've had the yard sales, we've had the Belschnickel be here, the Prime Dance Studio, there's lacrosse, there's soccer, the Boyertown Optimists, there is basketball, cornhole leagues, pickleball. I mean, that's community. We partnered with Lyft in Pottstown, where we receive guests who are homeless. They take showers, but there's also time that they can have a cup of coffee, a tea or beverage, maybe a soup. It's beyond just a shower. It's a time that they can come and get refreshed, but also to know that they are loved. Here at North Campus, we're able to reach beyond what we were able to do before, and that is to connect with the community, to know that we are in this together, that we are for our neighbors. And so finding ways to connect, that's what it's about. We are here for the kids and for the students. Let's grow together, let's have fun together, and let's serve together. So this facility right here, it's used on Tuesdays and Wednesdays for that purpose, on a regular weekly basis, for the students to come to know that it is a safe space, that whether they love to play sports, to hang out, to talk to others, to build relationships, we need that in our world today. And sometimes we ask the question, if our church wasn't part of our community, would the community miss us? My prayer is that, yes, the community would miss us if we're not here.
Tower Health Urgent Care is a full-service urgent care facility. We treat a variety of ailments and injuries, everything from cold, flu, COVID symptoms, through minor lacerations, chest pain, shortness of breath, abdominal pain. We have the ability to treat and stabilize all forms of illnesses.
We take care of everybody coming through the door, and that could be from a newborn to 100+ years old. For many patients that we see with minor conditions like colds, flus, viral infections, traps, rashes, urinary tract infections, we are capable of running tests on site. And most of these tests really, you get the results within 15 to 20 minutes. We are proud to say that we have PCR testing for COVID, for strep, and for influenza A and B. So basically we see almost every condition. For injuries, we do have X-ray, which really I'm very proud of our service. So we have a great service in the way that our X-rays is read by a radiologist within 30 minutes. So the patient really leaves our facility knowing exactly the final result of their X-ray. So that's very important for care.
We are open 9 a.m. to 9 p.m. 365 days a year. The Gilbert School facility opened in March of 2020. We had a very unique and chaotic opening. At that time, we had been 2 months into a very new and very scary pandemic. There was a lot happening for our team, and they did an excellent job in remaining calm and providing incredible care to the community. In the year 2020, when we went live, we saw well over our budgeted amount, well over what we thought, even treating only COVID symptomatic patients. We saw and tested 6,000 patients in that year from March to December. And then in 2021, with the most of that year also being COVID testing, we saw a total of about 12,000 patients. I mean, for a newer location, the community really clearly needed this service. Patients presenting to any Tower Health urgent care facility can be greeted as a walk-in patient. No appointment is necessary. We strive and we hit the metric of an average wait time of 15 minutes and a total care time of 45 minutes, bringing the whole visit within 1 hour. So that is something that we pride ourselves on. There is no appointment needed, so when you walk in, you may see a different provider every time. We staff with a combination of physicians, physician assistants, and nurse practitioners as our primary care providers. So those are who the patient will interact with and receive a treatment plan from. We have truly the full cadre of staff at this location.
Our staff and providers work tirelessly to be able to really cover all the shifts and be able to see that huge amount of patients that we had. It was tough. We really went through a difficult time. But luckily right now everything is starting to normalize, and hopefully there's a light at the end of the tunnel.
Community Health and Dental Care is so excited to be in the Boyertown community with adding our new location. This is our health center that we developed for the people in our community to give everyone better access to medical, dental, physical therapy care. So the vision of a federally qualified health center, what they're looking to do is to give people a medical home and not use the emergency room as a place for their health and dental needs. With the population continuing to lose insurance, the number of people with uninsurance, that's why these health centers were created, so people could have a place to go to and with not having a problem with not being able to pay the bill. 10,000 people a day are turning in the Medicare age in the nation. So we're living longer, we're aging longer. We got to start preparing for now. In 2020, we were awarded a state grant with the Department of Health and Human Services, which gave us the funding to renovate and to lease this facility and add the equipment to build the programs that are needed. What our mission is to really focus on taking care of people throughout our community and not have them utilize the emergency room for non-emergent care. Everyone knows we should get a medical appointment once a year, a dental appointment twice a year, and what we're really trying to design over the past 12 years is having it easier for people where you can come get your medical appointment and also get a dental appointment on the same day. We have free transportation. We have care managers on site that can help people if you need to renew your Medicare benefits, if you need to enroll in Medicaid, to understand your insurance. That's very crucial. We have translation services available for everybody. We have care managers. if people are struggling with medication costs, because we're a federally qualified health center, and if you're eligible, you can get prescriptions for as low as $5. So we really have built the health center over the last 12 years to really have it easier. We're a center of excellence for the state, which is exciting. Governor Wolf gave us that award back in 2016 because of the opioid epidemic. So we have center of excellence staff available. We have a medication assisted treatment program to help people. We have added physical therapy to give people another option for pain management. If you look down, Route 100, there's not a lot of options there available for people, especially that, could be afforded on a sliding fee scale, which is what we offer through our federal program. So there's no reason why we all can't keep up with our healthcare. It's an exciting organization. There's not many of them around the nation. And to have community health and dental care right here in the Tri-County area is honestly a privilege. There are things that we will be promoting for people to come out to check out the health center and to ideally, take advantage of free screenings. At the end of the day, what we're really trying to do is just build a stronger and healthier community.
General Carl Spaatz, he's considered the father of air supremacy for the United States Air Force and for our country. He was an innovator, born here in Boyertown, and one day, as I was driving up through Boyertown, it occurred to me, this is where General Spaatz was born and raised. I should go see the museum while I have some time. So I drove around for a while, but I didn't find the museum. And that's when it hit me that, somebody who was so significant in his contributions to the United States, and there evidently was not a museum dedicated to General Spaatz and his story and the surrounding story from Boyertown. So that's when I made the decision that we need to put a museum here and recognize those things that he did. We had to look around for a building, and fortunately we found this one, which originally was where the Boyertown Auto Works made their undercarriages and chassis and so forth. Our actual work on this building started in January of 2019, and it was full bore from then on for the next 3 years. In the interactive concept that we developed, individuals actually have to participate in the exhibit for it to work. We have 2 talking portraits in the first 2 exhibits that are interactive in nature and kind of unusual. We have so many different things that really bring people into the feeling, though, of being on board a B-17 or a B-24, including the present exhibit that I'm standing in right now, which is where we have our mission briefings. In these mission briefings, the individual does have to take part in
this is where we're going after,
for
right here.
the experience to actually work. They also have an opportunity to put on gear and equipment that the airmen had to wear to make sure that they could survive and fight at those altitudes. As we go further in our interactive experience, it even gets better because we have a B-17 flight experience video, which puts you right outside the aircraft of a B-17 in actual combat over a target in Germany. In our scenario, you end up getting shot down, you land safely in occupied France, and you're picked up by the resistance, which takes you to a safe house. What that actually is, though, is an escape room. And you have 20 minutes to find 4 things. And even if you get that, you still end up getting captured, and you have to go to the POW hut. And in the POW hut, you have to break out, and you have to find 4 more things to be able to accomplish that breakout. And this is a lot of fun as far as having 2 escape rooms, which we think is really unique. It's a very big hit with the young people. In the Hall of Heroes is a 174-foot-long hall of local people from 4 counties, Berks, Bucks, Montgomery, and Chester County, who contributed to victory in World War II. It's quite extraordinary, and there aren't too many exhibits or museums, for that matter, that have the same thing. It's quite unique. This is a learning experience for the younger generation. The sacrifices that were made and the challenges that airmen had and the challenges that all service people, including those who are here at the home front, it's a story that needs to be told, especially now since our World War II generation unfortunately is fading away. The biggest reason we're here is actually as a learning tool for all generations and future generations to recall.